Welcome back. Joining us now is Cass Mitchell, who has diabetes, and Sue has stuck around. She's the certified diabetes educator who worked with Cass. So Sue, thanks for staying with us, and Cass, welcome.
Thank you. Glad to be here.
Thank you. We're glad to have you. So let's start with you, Cass. When were you diagnosed with diabetes?
I was diagnosed in 1992 when I was still a professional chef in California in the Napa Valley.
And did you have symptoms or have any indication that you might have diabetes, or how did that happen?
A couple of years earlier, I'd been told that my blood sugar levels indicated pre-diabetes, but I didn't know what that meant. I didn't take it seriously.
And then when you got that diagnosis, what were your first thoughts? How did that make you feel?
Well, it made me angry. I felt like all I knew about diabetes was that you couldn't ever eat sugar again, and I was a professional chef, and I thought, what? So it was a problem.
So you said that you didn't take it seriously. When did you start taking it seriously, and when did you bring in Sue?
Well, I was living in California at the time, and so my physician directed me to take some group classes and gave me a lot of literature. And I started in on oral drugs, and then some years into that, I think maybe 10 years into it, my disease had progressed to where I needed to start taking insulin. And then I got really serious about it, because once you're taking insulin, if you screw up, you can kill yourself or go into a coma.
Right, yeah, any medications, you need to be careful with that, so that's good. So Sue, when you started working with Cass then, so she mentioned that she was a chef. When you try to individualize people's plans around their lives, how do you go about doing that, and how did you do that with Cass?
Well, we talk, and I listen a lot and try to focus on what did Cass want to focus on, what were her interests. If she didn't want to talk about food, we didn't need to, and we could talk about something else. And introduce Cass to some different technology, some new technology over the years that we've known each other. It's been several years, so that's kind of the approach. It's so personalized and one-on-one. Everybody's different.
So at this point in Cass's management with her diabetes, you see her about every 3 months, right? And so is that pretty typical, or does that depend on the person? How often do you know when to work with somebody?
It really depends on the person. Sometimes we see people once or twice, and then they choose not to see us anymore. Sometimes people get the benefit out of seeing us, and they're really utilizing their benefits from insurance, and they choose to come back every 3 months for follow-up and support. And that's what I think what we're really doing, is that we're past the teaching point and we're at the support portion.
So Cass, let's go back to you. When you learned about how you needed to take care of your diabetes, what were you able to do that still did fit with your lifestyle, especially with being a chef?
Well, learning, for instance, carbohydrate counting, which is an essential part of maintaining good blood sugars. Vegetables are carbohydrates, There's many things to figure out about what's going to affect my blood sugars, including emotions, stress, physical activities. And so I became more acquainted with the effects of those things on my blood sugars, and I was testing with my meter, and still, though, it was an imprecise thing. What ended up happening was that Sue recommended I get a CGM, a continuous glucose monitor, which is a little device attached to my body, and I can just look at my cell phone and see exactly what my blood sugars are and treat accordingly, and that has been revolutionary in my self-care. It's really improved my situation.
That is very cool. So what would you say was the hardest thing that you had to adjust to or accommodate to be able to manage your diabetes?
I think my brain was the big problem. I just didn't want to have it. I was in denial. It was a pain. And yet, the thing that's hard to accept about diabetes is that it's a lifelong condition. I don't know that anybody really recovers, I suppose a few, but you have to deal with it. Like, if you want to have continued health and a high quality of life, you have to come to grips with what you've got and use the tools at hand to produce the highest level of health.
So what would you say is the most valuable thing that you've gotten with working with Sue and having that diabetes educator support?
Well, in terms of hardware, definitely the CGM. I would never have gone there without Sue's urging, because it just felt like, hardware, devices, modern medicine. You know, I'm a suspicious and rebellious type. So I needed persuasion from someone who's very good at it.
Sue, can you talk about what that is just a little bit? I'd never heard of it before, to be honest. Okay. So what is that device and what does it do for folks?
Well, a continuous glucose monitor is a tiny hair-like sensor under the skin. It's monitoring their client's glucoses every 5 minutes, 24/7. Depending on the device, the one that Cass has can alert her to lows and highs. And it not just tells her what her glucose is at that time, it shows her what direction she's going at what rate of change. And Medicare started covering this for some clients who were on multiple daily injections of insulin in the last few years. So that's why some people aren't even aware that it's a possible benefit.
Okay, well, it's cool, and I'm glad it's helping you, Cass. So, Sue, Cass clearly is a little bit feisty. She talked about that her brain was kind of her biggest barrier to overcome. Can you talk a little bit about if somebody is sitting at home and they're in denial too, what's your advice to them right now?
I guess I'd say find a diabetes educator, find one you fit with. We all have different approaches and styles on how we work with things. Some clients prefer to see someone else than me. Cass and I were just a really good fit. We have been. So I encourage them to see their provider, ask for a referral to a dietitian or a certified diabetes educator, and just go in with an open mind, give it a try. They can go in once. If they never want to go back again, that's okay. But statistics are less than 10% of Medicare clients ever see a diabetes educator once in their lifetime. And you live with diabetes every single day.
Yes, so. For sure. And you mentioned that too. And we are really close to being out of time, but I wanted to finish with you, Cass. Any closing thoughts that you would give to somebody watching right now who has diabetes or may be at risk?
I would urge them to be proactive in their own self-care and give it their best shot, because it's only going to make a positive difference in their lives.
Perfect. Thank you so much, ladies, for being here and for sharing your story, Cass. Coming up next, knowledge is power, and getting diabetes education is good sense for good health. But what are the options for getting diabetes education and support? We'll tell you right after these messages. Don't go away.